If you're feeling sick or you're in an accident, you want to be able to get the medical attention you need. From birth to death, we only get this one body, and we need to take care of it. That's why this issue of healthcare is critically important to you and everyone you know. One woman was having symptoms of a heart attack, but when her family urged her to go to the hospital, she was worried about the expense. She said, "I'm not going to pay hundreds of dollars just to have a doctor tell me that I'm having a bad reaction to something I ate." Yes, she had health insurance, but her plan had a $5,000 deductible. Insurance wouldn't pay for anything until she'd spent that amount out of pocket within a year. Just being admitted to the emergency department can cost hundreds of dollars, and that's before any tests are done. So she lay in bed, feeling like an elephant was sitting on her chest, and hoped the symptoms would go away on their own. She was, in fact, having a heart attack. Conservatives, liberals, and radicals absolutely agree that lack of access to high-quality healthcare is a problem, and they share the same goal of health and well-being for all. But they strongly disagree on how to achieve that end. That's what all the fights are about when it comes to healthcare. It's time to hear the voices.
So about that heart attack. A person almost died because she hesitated to get medical care. But don't blame the hospital, doctors, or insurance company. Blame the government. Every time it imposes burdensome rules and regulations on health insurance companies and medical providers, the prices for health care go up. That's why it's so hard for people to afford the medicine and treatments that could save their lives. When providers and insurers are able to do their jobs without interference from the government, healthcare prices fall, and our world-class healthcare system benefits millions more people. Transparency and accountability are built in because businesses want to make a profit, so they act responsibly to keep our loyalty. They know that if we're unhappy with their products, policies, or practices, we'll vote with our wallets and move to a competing firm. The profit incentive also leads companies to develop the most advanced medicine, biotech, and insurance options on the planet. And the siren song of profit attracts the best and brightest to jobs in the healthcare industry. That's how we get skilled surgeons, talented diagnosticians, and reliable insurers. In every way, free market capitalism delivers the best healthcare outcomes for all. Liberals, the government should not be in the business of providing health care, period. Having a test done, taking a medication, being fed in a nursing home, these are deeply private experiences that should stay between patient and provider. But you invite government into the treatment room. You give it power over our most personal decisions, including whether a dying person can try a life-saving drug. That's absurd, but it's business as usual in the fair market healthcare system. It bleeds us dry with high taxes and high prices, and all we get are clunky government programs that offer mediocre care. Firms can't operate profitably, families are buried in medical debt, providers have their hands tied with regulations, and insurance companies are forced to keep raising premiums and denying treatments that could save lives. Liberals condemn us to death by 1,000 cuts. Radicals, when health care and everything else is handed out for free, there's no motivation to work. And when people don't work, no revenue is generated, so there's nothing to tax. That's why your universal health care system is a non-starter. You can't pay for it. Even if it could get off the ground, democratic socialism has no profit incentive, so there aren't any new advances, and no one pursues a career in medicine. It's too much work for no reward. We get substandard health care where people wait days to get a doctor to set their broken arm. In a single-payer system, waiting is the only option. Of course, everyone demands to see a top specialist because why wouldn't they? And there are no copays or deductibles. That causes shortages, so healthcare councils are forced to ration health care. Radicals should bury the single-payer policy before it buries us. Here's what we should do to pave the way for health and well-being. Deregulate the healthcare system and use private health insurance. With free market capitalism, we get a wide variety of options for every budget and need. Healthy people can buy basic coverage, and those with health concerns can buy more coverage. We also expand health savings accounts so people with high deductible plans can afford out-of-pocket expenses in an emergency. And here's more good news. We get rid of Medicare and let working people save and invest their own money for the insurance they choose in retirement. In the rare case that someone can't afford rock-bottom premiums, private philanthropy steps in. No one falls through the cracks, and everyone gets the health care they need. So, about that heart attack. It's a bitter pill to swallow when you pay a fortune for health insurance and still have to worry that you can't afford the care you need. Without government watching our backs, we're vulnerable to fraud and abuse by insurers and providers. No one should have to make life or death decisions based on the balance in their bank accounts. We absolutely want and need state-of-the-art health care, and we want transparency and accountability. A strong public-private partnership gives us the best of all possible worlds. It lets us benefit from the gifts of the profit motive and the security of a government that has our best interest at heart. Profit motivates firms to innovate and bring amazing new products to market. That's how we get competitive insurance plans, life-saving devices, and sophisticated diagnostic testing. Government regulates insurance firms and medical providers to make sure they use best practices. Government also creates access for everyone to get the care they need, including low-income and elderly people. Fair market capitalism keeps us physically, mentally, and financially healthy. We get the highest quality, most affordable, and most accessible health care system in the world. Radicals say farewell to life-saving surgeries, advanced genetic research, and new technologies to cure diseases. Democratic socialism kills innovation and motivation by making the drive for profit something to be ashamed of instead of celebrated. We lose our best and brightest, and that brain drain sets us back decades. When government is the sole funder and provider of health care, it's left to healthcare councils to set the prices, make the policies, and determine our coverage. Call a code blue right now. Sure, a public option is important, and government does need to play a vital role. But imposing a single-payer system on everyone is a terrible idea. No competition, on top of no profit, on top of non-experts at the helm? We limp along with a failing system run on apathy. The radical plan sends us back to the dark ages of sickness, suffering, and death. Conservatives, it's irresponsible to throw regulations out the window and leave it to private health insurance firms and providers to self-regulate. This idea is not just foolhardy and naive, it's deadly. Everyone needs health care, but your plan leads to sky-high prices, masses of uninsured people, and scary, low-quality care. While firms rake in billions of dollars in profit, people suffer and die. Claims are denied, premiums shoot up, and insurance policies get canceled as soon as people get sick. The poor can't pull themselves up by their bootstraps when they're too sick to get out of bed. But conservatives want to get rid of Medicaid and subsidies. Now masses of workers call in sick and the whole economy tanks. And what's the first thing that gets cut? Private philanthropy. There goes the free market fix for legions of low-income people who can't afford health insurance. Here's what we should do to pave the way for health and well-being. Strengthen the regulated, for-profit healthcare system and government healthcare programs. The Affordable Care Act has us covered. It gives everyone access to high-quality, affordable insurance that includes essential health benefits. No one is denied coverage for a pre-existing condition. People who aren't insured through work can purchase their own policies from private insurance on government-run exchanges, or they can choose the public option. Health insurance subsidies and expanded Medicaid make it affordable for all, and we fund those programs by taxing the wealthy. And because there's a healthcare mandate, insurance firms are able to stay profitable. With all of this and more, fair market capitalism is the best medicine to cure our ailing healthcare system. So about the heart attack. It's completely unacceptable that anyone has to choose between getting the health care they desperately need or being bankrupted by outrageously high medical bills. The mission of the for-profit healthcare industry isn't to preserve our precious lives or alleviate our suffering. No. The mission of healthcare and capitalism is to enrich the bottom lines of private owners and prioritize profits over people. In democratic socialism, health care is a basic human right. We guarantee optimal well-being from cradle to grave, and we fund it together so our universal healthcare system can provide gold standard care. We have sophisticated medical facilities, top-notch practitioners, and cutting-edge research. All our medical care is covered, so when we get sick or injured in an accident or have a disability, we don't have to worry. When we leave a provider's office, they hand us follow-up instructions, but they don't hand us a bill. With a commitment to social safeguards, we invest in one another's health so we can lift the well-being of our whole society. Then every person is able to contribute their talents and skills to the world. Conservatives, when it comes to healthcare, it's barbaric to leave it up to individuals to sink or swim on their own. You let the elderly, the disabled, the sick, and the poor suffer and die from preventable illnesses. Your low-budget private insurance options don't actually cover anything, so people end up bankrupted by medical emergency. And private insurance firms write policies with hidden clauses that let them deny claims when people get sick. At the same time, hospitals inflate prices, which means people avoid getting the care they desperately need. Then pharmaceutical firms, in a hurry to make a buck, rush new medications to market, and people suffer and die from the side effects. Following the conservative plan to let profit motive guide our healthcare system is a deadly prescription. Free market capitalism is a threat to human life. And you liberals want to prop up the for-profit health insurance industry, which wastes billions of dollars a year on advertising and pointless paperwork. Does it improve care or bring us better medicine? No. Does it line the pockets of private owners and make healthcare prohibitively expensive? Yes, it does. In fair market capitalism, the rich can afford those high prices, but tens of millions of poor and middle-class people are left uninsured. The middle class goes without care, or they go bankrupt from medical debt. The poor go through a humiliating process of proving their eligibility for Medicaid, and then it only offers bare minimum benefits. Meanwhile, seniors have to pay out of pocket for parts of their Medicare coverage, even though they paid into the program for decades. Expanding the liberal public option is not the solution. It won't work because it doesn't pull the plug on capitalism. Here's what we should do to pave the way for health and well-being. Use a single-payer healthcare system. In democratic socialism, health care is not just a right we all enjoy, it's a responsibility we collectively fund. Everyone pays a percentage of their income in taxes, and everyone has access to state-of-the-art care. No one is burdened with premiums, deductibles, or copays. No one lies awake at night worrying about whether they can afford treatment, and there is no reason to worry about the quality of care because health care councils make sure there's oversight, accountability, and transparency. Universal health care is a for-people system, not a for-profit system. It guarantees that we all get the medicine, surgeries, therapies, and everything else we need to thrive.
You've just heard the arguments about healthcare from three perspectives. Conservatives, liberals, and radicals each want health and well-being for all, but they have very different ways of achieving that goal. Now, it's time for you to be part of the conversation.